The time has come to dig into our second CRNA resume review video. Objectives these days, totally optional. I think yours is well written. We're just going to dig right into the work experience because I feel like we got a lot to cover between 2 pages. Many people will disagree with me on this take, but I personally believe when it comes to specifically applying to CRNA school, we as CRNAs know what caring for critically ill patients means on an ICU. And I think that we are more interested in knowing about the type of unit that you're on and the type of patient population you took care of and how you got involved in your unit more than anything. So I want you to concentrate your energy there when telling me about your places of work. So it's a medical surgical ICU. You've been there since April of 2023. Love that. Provided exceptional detail-oriented patient care, performed assessments and implemented nurse-driven protocols and interventions at a 39-bed medical surgical intensive care unit. Okay, so I feel like we got a lot of words in here and some of them are a little bit, it kind of speaks for itself, right? If you're at a 39-bed medical surgical intensive care unit, I know that you're performing assessments. I know that you're implementing nurse-driven protocols. So I think we can leave those things out. But if you want to specifically say that you provide detail-oriented patient care as like a little bit of a clue of the type of person you are, I actually really liked reading that language. So provided exceptional detail-oriented patient care at a 39-bed medical surgical intensive care unit at A, and then tell me a little bit more about the hospital. Is it a level 1 trauma center? But since it's a mixed medical and surgical ICU, like I want to know how sick are those patients? Like what are you seeing? Because sometimes when medical and surgical ICU units are mixed, the acuity is actually lower. So this is a great opportunity to prove me wrong. So tell me about the size of the unit. I like 39 beds. I want to hear about the type of hospital and I want to hear types of patient populations that you took care of on that unit. So patients after transplant surgery, patients after open abdominal procedures. Is this really mostly medical patients? Like, is it mostly sepsis, ARDS? Like, just give me like a couple like hot things you tend to see a lot up there. Manage invasive lines, comma, life support devices, say life support devices, right? Not just devices, comma, and administered various intravenous medications. That's kind of a given. Nix the intravenous medications part. Let's get more specific than titratable drips. Vasoactive infusions. Instead of saying arterial lines and central lines, you could say invasive hemodynamic monitoring. Typically, we as nurses are not really managing the ventilators, so you're better off just saying like you took care of mechanically ventilated patients, like unless you were doing the job of respiratory therapy and like physically managing the ventilator yourself, like that's not really true. And that's great that you do CRRT. I love that you included that there.